Hello, I'm Dr. Malbatel. I'm a men's health specialist and urologist and co-founder of Men's Health Clinic Manitoba. Have you heard of intracavernosal injections, or ICI? It's actually been around since the early 80s. It is essentially a direct penile injection where we're injecting medication to get an erection. The medication that you may have heard of before include Bimix, Triamix, Quadmix, or Super Trimix. The medication works by injecting it directly into the penis, and after 5 to 10 minutes, you're able to get an erection that ideally lasts for about 30 to 60 minutes. It's actually been around since the early 80s, and it's quite a safe method to achieve an erection if other options like sildenafil, tadalafil are ineffective, or those pills are just not working enough, or you're getting side effects from the medication. So in this video, we'll talk a little bit about how to do the injection and what to watch out for. So how does the medication work? Similar to pills like Viagra and Cialis, they work by increasing blood flow to the penis. The injections will essentially open up those vessels, get blood flow into the penis, allowing you to get the erection. When it comes to the dose, it is patient-specific, and it's really important to speak to your healthcare professional in terms of how to do the injection properly and understanding what dose is right for you. Because unlike the pills, you actually need to start at a low dose and find the dose that works with you and to use that consistently. When it comes to the injections itself, you do not want to use it more than 3 times per week and no more than 1 injection in 24 hours. And you really don't want to combine those medications or the injections with any other pills like Viagra or Cialis. So what do you need to do to prepare for the injection? So you need to make sure that you have all your supplies. So that'll be the needle itself. You need to make sure you have the medication, which is going to be stored in the fridge. You need to make sure you have a sharps container, so something to protect those needles. You need to make sure you have alcohol swabs. It's also important to have Sudafed at hand. And the reason for that is that if you develop something called Priapism, which is a prolonged, painful erection, Sudafed is important to take to stop that erection. And then finally, you want to make sure that you're setting yourself up on a stable table, usually a countertop, or potentially a bedside stand. So step 1 is making sure that you have all your equipment with you. So you're going to have your medication that you got from the fridge. You're going to make sure you have your needle, as well as an alcohol swab. Now make sure you also have a clean environment. You wash your hands to prevent any risk of infection. So as you can see here, there's going to be numbers on the side of the needle. This needle has 10, 15, 20, 25, 30. So you really want to start at a low dose and you're going to work your way up. So you really want to speak to your healthcare professional in deciding what number to start at and how often to increase the dose if it doesn't work. So now we're going to get the medication prepared. So you take your alcohol swab and you're going to wipe the tip or the top of the medication. You're going to take your needle that's protected by this orange stopper. So you really want to be careful with that needle and make sure that you do not contaminate it. You're actually going to get some air into it. It's going to help you draw easier. And then once you put that into the container, you're going to inject that air in, and that's going to allow you to withdraw the medication. And you may ultimately get some tiny air bubbles in there, and you can flick it to get it out, or you can push it back in. And then you're going to find the number that corresponds to the dose that was recommended by your doctor. And then once you have that, you take the needle out, and again, avoid trying to get it contaminated, and then put it back into the covering. Now, I tend to recommend patients to put their hand out like this to avoid poking themselves in the finger, and that you cover the medication up. And now you have your dose. So step 2, we're going to prepare the penis for the injection. So as you can look here as we zoom in, at the 12 o'clock position, you're going to have some veins located at the 12 o'clock position, and then your urethra is actually located at the 6 o'clock position. So when we think about penile injections, you really want to go at the 10 and 2 o'clock position. That's going to be sort of the side of the shaft on both sides. Now, the one thing about the penis is that there's 2 cylinders inside, and they actually can connect in the middle. So you actually only need to inject on one side to get the medication to both sides of the penis. Now, when it comes to this, we're going to use our non-dominant hand. So I'm left-handed, so I'm actually going to use my right hand to pull the penis out. I'm going to pick an area on the shaft that I think it's appropriate for the injection. So we'll pick here mid-shaft. And now that I have it all clean, I'm ready for the injection. So step 3, now that we have that area on our penis that's nice and sterile, we're going to take the top off our needle. We're going to be careful with it, and we're actually going to inject it directly in. We're going to inject that medication, leave it there for a couple of seconds, and then we're going to withdraw. We're going to recover that needle, and we're going to dispose of it. After the injection, it can often take 5 to 10 minutes for the medication to work, and ideally lasts for 30 to 60 minutes. So what are potential risks of penile injection therapy? Fortunately, they're not very common, but what can happen is, number 1, you could develop some bruising. And so fortunately, that tends to just go away on its own, but it may require some pressure to the area. Number 2, the risk of infection is actually quite minimal with penile injection therapy, but it is very important to use alcohol swabs to clean the area as well as the medication before you're participating in any sort of injection. And finally, there's something called priapism. So that is always the most concerning part about penile injection therapy. So what is priapism? Priapism is when you have a prolonged erection that lasts longer than 3 to 4 hours. So what can happen if you have this prolonged erection? What happens is the blood stays inside the penis and you're not getting fresh blood inside. And that actually cuts off oxygen to the muscle and can cause irreversible damage to the penis. So how do I prevent priapism from happening? Number 1 is following your doctor's instructions with respect to the dosing. Number 2, do not inject more than 3 times per week. And number 3, do not inject more than once in 24 hours. And finally, do not combine penile injection therapy with any other medications like Viagra or Cialis, as that could increase your chance of having a priapism. So what do you do if you develop a priapism? Well, if it lasts longer than 1 hour, take a cold shower, walk around, it may go away on its own. If it lasts longer than 2 hours, take 4 tablets of 30 milligrams of Sudafed, as that can help. Or if it lasts longer than 3 hours, then you do need to go to your urgent care or nearest emergency department for evaluation and treatment. If you leave an erection lasting too long, as we mentioned, it can cut off blood supply to the penis, and it can actually cause irreversible damage to the muscle of the penis. To learn more about erectile dysfunction, intracavernosal injections, or any other treatments for erectile dysfunction, please visit our website.